Stedholm with BPS News. On tonight's show, we have a special segment on the recently developed drug called INVOKANA. INVOKANA is a prescription medicine used along with diet and exercise to lower blood sugar in adults with type 2 diabetes. Type 2 diabetes is one of the fastest growing diseases in Canada, with more than 60,000 new cases yearly. 9 out of 10 people with diabetes have type 2. Initially developed by Mitsubishi Tanabe Pharmaceuticals in 2012, INVOKANA is manufactured and marketed by Janssen Pharmaceuticals, which is a division of Johnson & Johnson. INVOKANA was approved in March of 2013 as the first SGLT2 inhibitor that was approved in the US by the Food and Drug Administration. Normally, the kidneys work to keep your blood clean and chemically balanced. The kidneys also filter glucose, known as sugar, from the blood and return it back to the body for use as energy. In a person with type 2 diabetes, the blood flowing into the kidneys already contains a high level of sugar, which is then reabsorbed back into the body. INVOKANA works with your kidneys to remove about 100 grams of sugar a day through the process of urination. After the break, Katie Krupskaya will join us to discuss the pharmacodynamics.
Thanks, Julie. I'm Katie Krupskaya, the pharmacodynamics expert. INVOKANA, also known as canagliflozin, is an oral medication taken once daily. It falls under the class of SGLT2 inhibitors, or sodium glucose transport protein 2 inhibitors, a high-capacity, low-affinity transporter located in the brush border membrane of the proximal renal tubule, and it accounts for about 90% of glucose reabsorption. This transporter binds both sodium ions and glucose molecules, which then get translocated across the membrane, driven by the electrochemical sodium ion gradient between the tubular filtrate and intracellular space via secondary active transport. The glucose is further transported across the basolateral membrane, down its concentration gradient, and into systemic circulation via GLUT1 and 2 transporters. Normally, non-diabetic urine will never exceed the kidney's ability to reabsorb, but when the rate of glucose absorption exceeds 375 milligrams per minute, it's then excreted in the urine because its concentration has exceeded the ability of SGLT2 transporters to reabsorb it. Therefore, INVOKANA inhibits the SGLT2 transporter, reducing the reabsorption of filtered glucose, lowering the renal threshold, causing an increase in urinary glucose excretion without inducing hyperglycemia, while reducing blood sugar levels and promoting weight loss due to loss of calories per day. Generally, it is a well-tolerated drug with many benefits, including lowered renal threshold for glucose, increased urinary glucose excretion, and improved glycemic control, as it has been reported to reduce fasting glucose levels ranging from 0.9 to 2.1 millimole per liter, with daily doses between 50 milligrams and 600 milligrams. Canagliflozin has an additional advantage of showing moderate but sustained efficacy even in patients with moderately impaired renal function. Due to the chronic osmotic diuresis by glycosuria, which is the excretion of glucose via urine, and increased urine volumes, we see small but constant reductions in systolic and diastolic blood pressure, reducing coronary risk by about 15%, and this same level of protection is provided by a 4 millimeter mercury reduction in systolic blood pressure. However, studies are still being done to determine the effects of the drug to the placebo on cardiovascular events like heart attack and stroke in patients with type 2 diabetes. This same osmotic diuretic effect also causes an early weight reduction, whereas the incremental weight loss over subsequent weeks is likely due to the caloric loss. With an average of 200 to 400 calories lost per day, weight loss of 2.4 to 4.7 kilograms has been demonstrated in 12-week trials of canagliflozin. Common side effects include genital mycotic infections, or yeast infections, in both females and uncircumcised males, increased urination, UTIs, hyperkalemia, orthostatic hypotension, increased thirst, as well as a small 4% increase in LDL cholesterol. Some more severe toxic effects include lower limb amputations involving the removal of the toe or part of the foot, dehydration, ketoacidosis, kidney problems, hypoglycemia, or low blood sugar, and there is also a risk of bone fractures while taking INVOKANA. Tell your doctor if you take diuretics, rifampin, phenytoin, or phenobarbital, ritonavir, or digoxin. Tell your doctor if you are or plan to become pregnant, are breastfeeding, or plan to breastfeed, as INVOKANA may harm your unborn baby. If you become pregnant while taking INVOKANA, tell your doctor right away. INVOKANA may pass into your breast milk and may harm your baby, so do not breastfeed while taking INVOKANA. Also, do not take INVOKANA if you are allergic to canagliflozin or any of the ingredients, or if you have severe kidney problems or are on dialysis. Before you take INVOKANA, tell your doctor if you have a history of amputation, heart disease, or are at risk for heart disease, blocked or narrowed blood vessels, usually in the leg, damage to the nerves of your leg, have diabetic foot ulcers or sores, kidney problems, liver problems, history of urinary tract infections, or problems with urination. Also, if you are on a low-sodium diet, are going to have surgery, are leading less due to illness, surgery, or change in diet, pancreas problems, drink alcohol very often, or have ever had any allergic reactions to INVOKANA, or if you have any other medical conditions. Thanks for having me, BPS News, and now off to my colleagues Zoe and Alana for the pharmacokinetics aspect.
Thanks, Katie. INVOKANA, or canagliflozin, is a dose-dependent drug with a half-life varying between 10.6 hours for a 100 mg dose and 13.1 hours for a 300 mg dose. The drug reaches its peak concentration at approximately 1 to 2 hours following administration. We can explore the ADME path of canagliflozin to better understand it. INVOKANA is an orally administered pill in 100 mg or 300 mg doses with a bioavailability of 65%. Its subjection to first bypass is suggested. Canagliflozin can be taken with or without a meal and is not affected by co-administration. An intravenous infusion of canagliflozin in healthy individuals presents a volume of distribution of 83.5 liters. This suggests that a lot of the drug will be distributed to the tissues rather than in the blood. The volume of distribution will increase with higher body fat percents. Additionally, approximately 99% of INVOKANA is bound to proteins, most of which to albumin. It is also a substrate for P-glycoproteins and MRP2, subjecting it to be pumped out of these efflux transporters. This explains the approximate 10-hour half-life of one administered dose. The metabolism of canagliflozin follows two pathways, O-glucuronidation and CYP3A4, both of which act in the liver. O-glucuronidation is a major pathway of the metabolism occurring in the liver. It involves the transfer of glucuronic acid from UDP glucuronic acid by UDP glucuronyl transferase, transforming canagliflozin into inactive O-glucuronide metabolites. The metabolites are hydrophilic and are sent on for excretion. CYP3A4 is a minor pathway of metabolism, with only 7% of the administered dose undergoing it. CYP3A4 will oxidize canagliflozin into metabolites sent on for excretion. O-glucuronide metabolites are the main excretion form of canagliflozin, which exit the body in the urine. The renal clearance rate is 1.3 milliliters per minute for a 100 mg dose and 1.55 milliliters per minute for a 300 mg dose. Now back to you, Julie.
Thanks, Zoe and Alana. Now off to Melanie Pitt in the lab for some additional information.
Thanks, Julie. On average, INVOKANA costs about $350 to $450 per month, depending on the country in which you reside. Since it is a relatively new drug, lower-cost generics won't be available for many more years. To find out if your costs may be covered, please contact your insurance provider. On Monday, May 18, 2015, the FDA warns that the class of SGLT2 inhibitors can lead to a life-threatening condition called ketoacidosis. Ketoacidosis usually affects only 1 in 100 people, but between March 2013 and June 2014, the FDA received 20 reports that the drug triggered ketoacidosis, in which levels of blood acids, called ketones, are too high. If left untreated, it can lead to a diabetic coma or even death. All 20 patients had to go to an emergency department or were hospitalized. Health Canada also reports an increase of approximately twofold risk of lower limb amputations, primarily of the toe, midfoot, or also of the leg as seen in the Integrated Canagliflozin Cardiovascular Assessment Study, the CANVAS program. The CANVAS program consists of CANVAS and CANVAS-R, two large, long-term, randomized, placebo-controlled trials evaluating long-term cardiovascular outcomes in about 10,000 individuals with type 2 diabetes, with established cardiovascular disease, or at least 2 risk factors for cardiovascular disease, who were treated with canagliflozin. It was found that INVOKANA significantly reduced the combined risk of cardiovascular death, myocardial infarction, and stroke in the CANAS program. These results were published in the New England Journal of Medicine. A study was done to evaluate the potential effects of canagliflozin on breastfeeding. Upon administration of radio-labeled canagliflozin to lactating rats, a milk-to-plasma ratio of 1.4 was found, indicating that canagliflozin may be transferred into milk at a concentration comparable to that of the plasma. Since human kidney maturation occurs in utero and during the first 2 years of life, when lactation exposure may occur, there may be risk to the developing human kidneys. A risk to the developing rat kidneys was observed when juvenile rats were exposed to canagliflozin during maturation. Over the course of 1 year, INVOKANA 300 milligrams, which is also available at 100 milligrams, and Januvia 100 milligrams were compared in a head-to-head clinical study. When both given in combination with metformin, which decreases glucose production by the liver, as well as improving insulin sensitivity in the liver, the muscles, and fat cells, as well as sulfonylurea, which stimulates the pancreas to release insulin. INVOKANA patients lost on average 5.1 pounds and had a lower A1C of 1.03, where A1C is glucose attached to hemoglobin, a protein found in the red blood cells that transports oxygen from the lungs to the other parts of the body. When Januvia patients gained on average 0.2 pounds and had a lower A1C of only 0.66. INVOKANA helped 43% of patients reach the American Diabetes Association recommended 7% of A1C, while Januvia only helped 35%. For more information on drug warnings, please visit www.fda.gov/medwatch or call 1-800-FDA-1088. And for more information on INVOKANA itself, please call 1-800-JENSEN. That's 1-800-526-7736. Back to you, Julie.
Thanks for tuning in, folks. Join us tomorrow for Pete's segment on monkeys terrorizing motorcyclists by drinking their fuel. I'm Julie Studholme, signing off for BPS News.